I return to the issue raised by the noble Baroness Lady Brinton about the situation today of clinically vulnerable and otherwise vulnerable groups of people. I note that the statement says the inquiry found that the pandemic had a disproportionate impact on vulnerable groups and continues to affect many people in those communities. Given that, as the WHO says, the COVID pandemic is continuing, we have the threat of multiple other respiratory viruses. I note particularly H5N1 is a great area of concern. How would the Minister assess the government's current approach to both clinically vulnerable and more broadly vulnerable groups, thinking particularly of their access to commercial spaces, community spaces, schools that have clean air, either through ventilation or filtration? And also, as Dame Kate Bingham from the Vaccine Task Force said to the inquiry this week, there was a concern that prophylactic antibodies available to people who cannot benefit in the same way as others from vaccines. Where are we at now in making sure there's treatment available to those people?
So I think one of the things that the pandemic threw up as an issue that all responders had to deal with was that it led to a redefinition of who was vulnerable, and I think it sort of it is something that LRFs and responders were very aware of at the time. The government's committed to engaging widely with vulnerable communities and civil society to ensure that the factors which affect vulnerability, including health inequalities and socio-economic inequalities, are much better understood as we review our approach to resilience. We are going to come back on the response to that resilience review later in the spring. We do, though, recognise that vulnerability should be a key focus, and it is a key focus of the Cabinet Office-led review of our approach to resilience. And in order to get the response right on this, we're engaging with charitable, faith and other representative organisations to understand how the reduction and prevention of disproportionate impacts to at-risk groups and persons can be better considered in our planning and policy.